Welcome to the Therapist Thrival Guide. My name is Miranda Barker. I'm a licensed clinical social worker. Today, we are talking about ADHD, and we have some awesome experts with us today. I'm going to let you guys introduce yourselves. Davin, do you want to go first?
Sure. My name is Davin Cobb. I am a licensed associate marriage and family therapist. I work at an Ellie Mental Health location in Georgia.
Christina, do you want to go next?
Sure. I am Christina Gonzalez. I am a licensed clinical social worker of Ellie Mental Health of Central Jersey, located in the Flemington office.
And Joey, you're next.
I'm Joey Lusvardi. I am a physician assistant, and I work remotely, but I'm based in Minnesota.
Awesome. I love having episodes like this where we can pull, number one, clinicians in from all over the country. Number two, when we can have a prescriber here to talk about these specific diagnoses. So Joey, you're kind of like our guest of honor, because it's important to be able to talk about how prescribers and therapists can be working together, especially when it comes to ADHD and like some of these diagnoses where medication is super helpful and effective and all those things. So wanted to just kind of get started by talking about, if you are a therapist working with a client and you kind of suspect that they have ADHD, or perhaps they've said, I've been wondering, I saw a TikTok the other day and I had a lot of the symptoms that this person was talking about. I think I might have ADHD. What is our first step? What do you do? I don't know who wants to take that first. Christina, Davin.
I mean, for me, I kind of run it down with my clients of what does that look like? How are you associating with it? Because sometimes it can be very real of you are having these symptoms, but is it isolated or is it kind of a constant thing? And kind of doing an inventory with them of how long do you feel like this has been going on and what does that look like for you? Kind of starting there with them.
What are some of the common symptoms that you do see for people who actually have ADHD then?
So the fidgeting, inability to kind of stay focused, impulse control. I see a lot of kids in adolescence. So it's that impulsivity of going from being completely fine to I'm going to have an anger outburst and do something that I'm not going to be able to come back from. And I'm okay, that you see, but I guess for the adults, it's more of the executive functioning piece of it, of time management and kind of creating routines and structures for themselves, which I see a lot.
Awesome. What about you, Davin? When a client says hey, I think I might have ADHD, what's your first step? What do you normally do with them?
Yeah, very similar to Christina. I like to normalize. I'm really big on normalizing and sitting with someone for a moment just to, okay, this is what you're feeling. What are these symptoms? How are you equating to these things? And then I kind of like to, because I work primarily more with young adults and couples. So I see a lot of times that I will point it out a little bit more before they will, particularly my couples. If one of the parties is having some executive functioning, the partners may be complaining about she's forgetting things all the time, and I don't understand why she can't remember this, and it's not that hard. Do this. Then I'm normally okay, well, maybe let's look at some other options, particularly that could be going on, because I think that a lot of times people with ADHD, there's a stigma of just being lazy. So I do look for that as well. Have you been told so often you're lazy? Do you have negative self-talk about yourself, about what you should be doing? What am I not accomplishing? And how is that showing up in your life? A lot of executive functioning is usually where I like to lean into. I like to start with normalizing, particularly pointing out things that I'm noticing, and then potentially looking at how do we need to move forward? What are you looking for to help you with some of the symptoms you're experiencing, whether that's getting with a psychiatrist and me working with them, or working on some routine and normalizing. This is how your brain works. There's no need of trying to become the it girl that you see on TikTok. Particularly, this may not work for you, but we can find something that does work for you.
That's super helpful. Do either of you recommend your clients go seek out a psych eval right away, or what is that something that is typically needed for an ADHD diagnosis, or do you feel like you are comfortable enough being like, this is what we're diagnosing? Like, what's the role of a psych eval with this?
So I mostly see kids and adolescents. So a lot of the times I will get either kids that are just diagnosed or school's speculating an ADHD diagnosis. So I will always refer for like a psych or a neuro eval, just for the kind of posterity of like knowing that they've done everything. And if it isn't this, like kind of figuring out where we are and providing all the support that they can actually like get. Because once school is like, oh, there might be ADHD involved, if there isn't an MD attached to like the diagnosis, they're like, oh no, we can't give support. So I will always refer like for that as like an extra layer.
Yeah. Yeah. Well, and like I was always told too that we really shouldn't be doing like our own, like we should be kind of referring for that additional diagnosis anyways. I don't know, Joey, do you have other thoughts on that too?
Yeah, I mean, I obviously like I trust like that y'all know what you're doing, and that like if you have suspicions about it, like you're not just going to randomly be like, oh yeah, like you have ADHD, that you're going to do a thorough evaluation, and I also think too sometimes like I've had people who've come to me and they've been a little bit like, I don't know. And then they'll talk to their therapist about it, and their therapist will be like, "Oh yeah, you've got ADHD." And it's really helpful to like, have that additional perspective, because there is still a stigma attached to it where people sometimes are like, I'm not sure if I want to get that extra label. I think it's worth, like bringing it up, and even if you're not comfortable, like being like, okay, this is definitely ADHD. Getting someone else involved who does feel comfortable doing that is like a really good idea. And I definitely think that, like most therapists are going to be able to recognize that like, hey, this is something that requires a little bit more evaluation. I think that's a good thing.
I guess most of the time when I have had clients who have said, hey, I mean, let's be honest, it has usually been like I saw a TikTok the other day and it made me think that I probably have ADHD. And I see a lot of college students. And so then I usually will say exactly what you were just saying, Christina. Okay, what makes you think that? Let's talk about symptoms. How long has this been going on? And then, referring for a more thorough evaluation, because even though I am someone who can be like, oh yeah, you totally, you fit the criteria in these ways, I usually want them to, have a more thorough diagnosis or a more thorough evaluation. So that makes a lot of sense. What about what about like role of medication, and like what sort of conversations, and anybody can take this, Joey, anyone, but like what sort of conversations do you all have about ADHD medications? And I guess like, you're really struggling. Have you thought about medication? Or I don't know, what does that conversation usually look like?
One of the big things to keep in mind with like medications is that like they do have a street value to them. And it's something that like you need to be very careful because they are sought out. I used to work at a college, and so I saw college students, and around finals time, like the number of ADHD evaluations suddenly spiked. And so you always want to be very careful about, like promising medications to anyone or promising a specific medication, because when they get to the prescriber, we might, like as we're doing our evaluation, they might be like, by the way, like I've got, bulimia or something, and I'm not about to give something like Wellbutrin, for example, which we sometimes use off-label for ADHD, to someone who has bulimia, because they might have a seizure and die. And that's, kind of a bummer if that were to happen. I'm usually trying not to kill my patients. So it's something that there's a lot to think about, and we have to spend a lot of time like ruling out that there's other things, or that there's like contraindications to the medications too, where, if someone has an eating disorder, then I'm going to be pretty cautious about it. If someone has a history of substance use problems, I might, go for something that's not going to carry as much potential for being misused. If someone has really bad anxiety, I might pick a different medication than I would if they don't have those issues. And there's a lot of things to kind of think about it. And it really depends on what the specific cluster of symptoms they're getting are. And one thing that I really try and emphasize too with my patients I'm working with that have ADHD is that they aren't magic pills and they're not going to solve everything. And I really try and encourage them, like, whether it's talking with me about like some things that they can do to try and make sure that they're setting themselves up for success with like their environment or their lifestyle, or they're talking about it with their therapist, like that we're coming at it from multiple angles. So it really is an area that like I pretty quickly try and get like therapists involved again if they haven't already had that conversation, because it's so critical that like they address it from both sides.
That's super helpful just to even know. I mean, I didn't know you could use Wellbutrin off label, like some stuff like that. I mean, I'm curious, beyond, so like what are the major prescription drugs that are used for ADHD?
Yeah. So we like to kind of divide them into two separate categories, which would be the stimulants and the non-stimulants. Stimulants are the ones that people are going to be most familiar with, more likely than not. That's Adderall or Ritalin or Vyvanse or Concerta or Mydayis, or there's a lot of them. Like there's a lot of different weird release formulations that like you can go down a rabbit hole of like all of the different like stimulants out there. But they're typically either going to be a methylphenidate product, which would be like Ritalin or Concerta, or they'd be an amphetamine, which would be Adderall or Vyvanse or Mydayis. And the big difference between them is going to be some people get different side effects from like one group versus the other, and then how they're released, so how long they last. And then the other group, the non-stimulants, those are going to be medications like clonidine or guanfacine or Strattera. And then there's a bunch that we use off-label, like we will sometimes use, like Wellbutrin mentioned earlier. Another one that we'll sometimes use off-label would be modafinil, which is a wakefulness-promoting medication, which to me, I always was like, that sounds like a stimulant, but we don't technically call it a stimulant. So it's a non-stimulant. And then even sometimes we'll, like, depending on what they're presenting with, there's a newer antidepressant called Trintellix that like originally they had been looking into it as being like, is this an ADHD medication? And then they were like, oh, it works really well for depression. And so it got approved for depression. And it's one that like we'll sometimes use it for people who have like really bad cognitive symptoms of depression. But I've had a few people that like, we're not like, for whatever reason, the other meds didn't work. And we're like, okay, we're desperate. Like, and they also have like depressive symptoms or they've got really bad anxiety. And I will try them on Trintellix as like a, like an out there option if it really comes down to it. But there's a lot of different choices out there.
There are so many. What are some common like side effects that you're seeing with some of these different drugs? And maybe this is like a two-part question where it's like, what do you want therapists to know, I guess, about some of these drugs, and like, how can we be working together? So maybe that's a three-part question, but you know what I mean? Like, how do we come together to like watch out for our clients and also like be in communication?
Totally. So let's start with side effects. Going to vary between individual medications, but typically like most of the ADHD medications, even some of the non-stimulant medications are going to be very like energizing. So like if you think about things that you would associate with like caffeine, like a lot of them are going to be side effects that you see with like Adderall or Ritalin or Wellbutrin. Big things are going to be increase in anxiety, insomnia, appetite suppression. We'll also see tremors sometimes. If they have a history of psychosis, it can activate psychosis. So like you want to be really careful with that. Or if like, patient who previously like didn't like have, you know, any like hallucinations, and they come in and they're like, there's gnomes running around the room. Like, I don't know. And you're like, I think that they were just started on an ADHD medication. That would be a good thing. Like, we want you to like communicate that to us, and like also encourage them to communicate that to us as well. So like, that's a big one. There are a few medications that like clonidine or guanfacine, which are blood pressure medications, but they also can help with ADHD. Those ones tend to be a little bit more sedating and calming, and they're really good for people who get a bit too agitated or wild or anxious from like a stimulant medication, or we'll sometimes use them in conjunction with them. I'm a really big fan of clonidine. We actually kind of joke that like I'm a clonidine influencer, because like I love clonidine. Like, I think it's really underutilized, and it can really help people who have like trouble sleeping, because they're like, I want to keep doing everything, because ADHD does not let you slow down sometimes. And so there's a lot of like different like choice, or there's a lot of different like things that you can run into with that particular set of medications.
Okay, you just made me think of something where like in the DSM-4, we had different diagnoses, right? We had ADD, ADHD, but now in the DSM-5, they're combined into your ADHD, right? Am I saying that right? Yeah. So do you prescribe differently based, I mean, I guess you just said you prescribe differently based on symptom set, but
kind of.
You've got, so perhaps someone with more of like the hyperactivity type, you would be more apt to prescribe them like a guanfacine, something that's more calming, or is that just not necessarily the case still?
Yeah, I would be a little bit more likely to be like, okay, maybe we go with like something like clonidine or guanfacine, where like, again, it's going to calm them down a little bit. Stimulants can work in any of like the subtypes of ADHD, where it's not like they're limited to the inattentive subtype. They do tend to be a little bit better than like clonidine or guanfacine would be, but both of those can also work for the inattentive subtypes or the combined subtype, where it really is like you have to like individualize it to the person, and also think of like their comorbidities as well too, because that sometimes will push me in one direction or the other, where if they're coming in and they're like, I've got really bad insomnia, I've got an eating disorder, like I'm anxious, like they're just sitting there like vibrating because they're so like nervous, like I'm probably going to hesitate to be like, you know, let's throw something in that's known to suppress appetite, cause you to have insomnia, and also potentially make you really anxious. Like, that just doesn't seem like a great idea. And I would probably lean towards being like, okay, maybe we go with clonidine, or we go with like Strattera, or we pick another medication that would not have those risks associated with them.
Okay. Yeah. I mean, I think that makes a ton of sense. Switching gears a little bit then, you talked a lot about how when you're initially seeing clients in medication management and they're not seeing a therapist, you encourage them to, because you feel like it works really well hand in hand. So kind of like transitioning over to Christina and Davin, curious about what are some common interventions and things that you're doing with your clients with ADHD? I don't know who wants to start.
I'll go. Okay. So a lot of the things Joy was just talking about, they really resonated with me because I am someone who has ADHD. So a lot of the times I like to have my clients create a story of like their experience, because I think each person's experience with ADHD is different. Like we said, there's many subtypes. So there's the inattentive, and then there's the hyperactive, and there's a combined. So I let them like create a story of their life, of what their experience is like through their lens. I often like to do that to understand what they're actually experiencing, because I think if we just take, I'm having a hard time paying attention at school, and then I think that this is what works for that, oftentimes that doesn't work, because as we know, as people with ADHD, routines do not work for a long time. So I'm really big on creating like, I call it like a toolbox of routines. So like this routine may work for you this week, and it's going really well, but next week it may not work. So we need another routine that's there because we want to reduce the amount of thought you have to have and how much you have to pull at all these different things. So I like to oftentimes when someone like even hints that they particularly may have ADHD or they're having trouble with focusing or impulsivity, I'm like, okay, well, let's create a story of your life. Like, give me a scenario in your life, write it out through your lens so I can understand what your experience is like. And then we work on normalizing that for them, because I think because TikTok University has become so influential, a lot of people are trying to figure out how to not have these symptoms. And I don't like to really go in that direction particularly, because I think it then also brings in this identity issue and self-esteem and the way I view myself. So I really like to curate what works for them in this place in their life, and also focus on what else is going on around you, because that can be influential. Like, there could be some comorbid things going on. There could be, you're just highly stressed and it's really making it really difficult for you to focus at work. So rationalizing, creating a story, and then a toolbox of routines just to help reduce, because one's going to stop. So having one right behind it may be helpful.
I definitely do kind of similar things in that aspect. I have ADHD as well. So like, sometimes it's like, oh, everything's perfect, great, I'm focused and can work. And then it's like, ooh, there's a squirrel and I'm looking outside. But I think too, with like the kids, it's also creating a toolbox for them of self-regulation. And like when they do start to compare, because I see a lot of it where it's like, oh, well, Johnny can do it. Why can't I do it? And it's usually like within the sibling sets too. If there's one sibling that has ADHD and then all the other ones don't, it's like, oh, they're the problem, quote unquote problem. But in reality, it's just, hey, we just need a little bit more to self-regulate and kind of get back to a baseline. And it's doing also a lot of like the parent education too, of like, what are we doing at home to promote that, of like letting them get out and creating systems that work for them. And there is that stigma on medication. So a lot of parents don't want to put their kids on medication. So it's like, okay, what are we going to do to release those outputs? And they're just going to have more energy, and you're going to have to let them run a little longer if that's what they need.
I love that. I see, and I haven't been working with this population for a super long time, but I feel like all of a sudden in the last, like, I don't know, 6 months, I think I have like 8 different people with ADHD on my caseload. And so it's been really cool to learn from them and learn about what works for them, because like what you said, Davin, I mean, stuff works differently for other people. And so I was going to say a couple of like key interventions or things that I will use, and maybe I should back up a little bit and say, like, oftentimes I say, okay, your ADHD isn't necessarily the problem. It's like, what are the symptoms that you want to be attacking? Because it's like, you can be a very hyperactive person and maybe you're in the right career field for that, and that doesn't really matter. But like, I mean, but maybe you're someone who cannot, like, you have, these different goals, or you have these different like work things that you need to get done, and you're having a really hard time getting through it. And so maybe in that area, I pull out my worksheet where it's like, literally, I can put a link to it in the description of this podcast episode, because from Therapist Aid, all it does is it talks about, let's break down that thing that you need to do. You have this task, let's break it down into like 7 subtasks, because I think that can be super helpful for a lot of like the college students that I work with that have ADHD. I also often, if I'm working with an adult with ADHD, I often recommend the book Scattered Minds. I don't know if you all have read this. Such a good book.
But I need to. Thank you.
What, Davin?
I said, I haven't read that, but that sounds great. I need to.
This is such a good book. The author of it has ADHD. And so I think that's super key when you're looking for books that are about neurodivergence. It has to be written by someone that has that. But I can't even begin to tell you how many times I've read, like how much I'm underlining in this book, how much I'm, like reading and laughing to myself. There was a portion in this book that talked about, and I had to read this to my husband later because I was like, oh my word, this is me. And has been me for my entire life. But it talks about like the absence of mind and distractibility. And this particular part of the book is something that I hear a lot of clients complain about themselves. And they'll say, I decided to clean my room looks like a tornado just passed through. I pick up a book off the floor to replace it on the shelf. And as I did so, I realized that there are these other books on there that I haven't looked at in a while. And then I picked up those books, and then I realized that, and then you begin to read a poem, and then you realize that the poem has a classical reference in it, which prompts you to consult your guide on Greek mythology. And now you're lost because one reference leads to another. An hour later, you're interested in classical mythology, exhausted for 1 minute, you return to your intended task. And then it's realizing that, oh no, a pair of socks has gone on furlough. And then you're trying to find it on the floor. And then you realize that you haven't done laundry. And so it's like you're going back, you're going from thing to thing.
Right.
And then at the end of it, you realize that you never cleaned your room. And I laughed out loud at this part because one of the really common, there are so many like little tiny interventions that you can kind of pick up from clients or just pick up from different podcasts or places over time. And in particular, that issue of distractibility can be helpful of like having, one thing I often recommend clients do is like have a laundry basket at the, like the threshold of your room. And so you're not allowed to like leave your room, because we all know that you can, grab a book and then you go to different rooms and whatever. But if you have a laundry basket at the threshold of your room and you're like, okay, I'm going to put everything in this laundry basket that needs to leave my room, then at least you're not leaving your room. You're still like focused in on your task, and you're just kind of putting things in a pile of like, okay, I'll deal with this in a little while. But all that to say, there are so many cool interventions or so many little things that we can be doing. Curious about other ideas that you all have had or things that you do with clients that have ADHD.
I'm a big proponent of lists and like being able to like physically cross things off. Like I will recommend like whiteboards, or like if they have like a glass door, like writing it with a dry erase marker, and then like being able to erase it and be like, okay, I accomplished that. But it's like also right in your face of like, hey, it's right here. Like you see it, like if you have to walk to the bathroom, it's right there and you see the list you have to do. So it's like that constant reminder.
Mm-hmm. Yeah, I was going to say kind of similarly to what you were saying, Miranda. I often tell my clients, like, get you one of those like little rolling things that rolls, and have a designated space for where everything that doesn't supposed to be in this room or here just goes there. And then at one point you can put all of those away. Also, something that I wanted to kind of highlight is sometimes these things just don't work because that's just not how your brain works. So I have a client who has really severe executive functioning issues. And at times I kept trying to throw away all these different interventions, and I realized she wasn't responding to them because they just weren't working for her. There was also another layer to this. She was dealing with like severe depression. So I think at times as clinicians, we have to be really flexible to understand that it could be many different things. Just because I have ADHD and I'm having issues with focusing, that may not be the only reason why I'm having difficulty in this area. That client particularly was in a graduate program, and we talked about environment. And she was like, when I go into work, I feel horrible. The environment, the people there, no one wants to help. So we were so focused on like this ADHD and executive functioning that when I like widened the scope and talked about like the systems at which she was operating in, she was able to identify that there were things outside of herself. Again, I think it's important to not solely always point at ourselves when you have ADHD, because it's very easy. The stigma is you're lazy. If it's a shoe on the floor, just pick the shoe up. I'm having a really difficult time picking the shoe up, so it must be me that's the problem. So focusing on like some identity work, as well as like what else is going on in your life. Sometimes switching from the main focus of this thing gives another area of opportunity to maybe work on switching your focus potentially.
I love what Davin just said there, where like people should like try and remind your clients that like ADHD isn't like the entirety of their like world. Like there are other things that can really affect it, where I get a lot of people who like around finals time, they come in and they're like, Joey, turn up the dial on my ADHD medication. And I'm like, have you considered you might be stressed out because finals are a terribly designed system? And it's one of those things that like, I could turn up their Adderall, and then they're going to be really anxious, and it's going to just create more problems. Or, you could work on talking about like, how do you reduce their stress, or like, how do you like figuring out some of those other things that can play a big role in like their functionality. From like a medication standpoint, one of the big ones I hear is like people who are on a stimulant and they don't get like really hungry at all. Like during the middle of the day, like they'll be like, yeah, it's weird. My medication doesn't seem like it's working as well in the afternoon. And I'm always like, well, did you eat lunch? And they're like, well, no, I don't get hungry. And I'm like, okay, like, so we need to like purposefully like add in eating, because weirdly enough, like as soon as they start eating during the middle of the day, their medication's working really well because they're no longer hungry. And it's something that like, it's a very, very simple like intervention. We're just reminding them that like anything you eat is going to help. I tell people like, I'm not here to be like, the diet police. Like if you want to eat like a slice of pizza and some ice cream, cool. Like if that's what you can eat, go for it. Like it's something that is going to help, and like taking some of those things into account too can really, really help people like end up being more successful.
I totally agree with that too, because like I see a lot of like the nutrition piece and sleep with my clients, where it's like they forget that basic ADL need of food and sleep are vital when it comes to kind of creating systems for an individual that has ADHD. Like those are needed regardless. So like just a reminder of having a snack on a list or having it in your pocket, it might be a helpful strategy too.
What about for clients that are struggling? I mean, that's something that's super common. I see a lot of clients struggle with sleep as a result of their ADHD meds. What do you all recommend for those clients? Like, do you recommend a med change, or like what sort of changes do you typically see that's helpful?
My first question is usually, when are you taking your medication? Because even for myself, if you take it at 12, it's probably going to be a little harder to go to, especially if it's an extended release, to go to bed at night. So like there's some clients where I was like, you need to set your alarm at 6:30 to take it, even if you're not getting up at 6:30 to take it, because you're having trouble sleeping because you're not taking it till after you eat. You don't eat until 12. That's going to make it really difficult. This is going to release in your body for a long time. And now you're trying to go to sleep and you're looking at the ceiling saying, I have insomnia now. So now that's a side effect. But also there is a way to be proactive potentially about that. Asking, when are you taking your medication? Are you drinking water? That was a huge thing with my college clients. They were on it and they would forget to drink water. The most common thing, just drink some water. As soon as she would drink some water, she's like, I feel so much better. You have dry mouth. All of these symptoms that are happening, there is a level of proactivity that needs to be there to help with that if you actually want the medication to work for you and not to be up all night.
After the medication question, I usually go on a wider scope of it too, of is there other external factors? Are there new stressors? Are there new things that are kind of going on? Because it's sometimes if it's not the medication, there's new things going on, work, school, just family life, like so many different things could be impacting it too. So not just being so isolative about it.
Okay, I know that we are coming kind of to a close, and so I'm watching the time. But before we leave, I know at least a couple of you have been diagnosed with ADHD and have like figured out how to thrive as a therapist with that diagnosis. And I'm curious, Davin, do you want to start? Like how have you gotten into a rhythm? How do you like thrive as a clinician with ADHD?
To be completely honest, it's a forever evolving thing. So I want to normalize it. Like there's some weeks and some days where I'm not killing it. And there's some weeks where I'll go into that routine box and I'm like, this is what you really need to crack down on for this week. For me, I think the same thing that I do to my clients, I do to myself. I work really heavily on like my own identity because at times, because I got diagnosed later in life, which happens with a lot of adults, especially women. So I look back at my life and I'm like, dang, you were always killing it in school. You always had good grades, but you always waited till the night before to do your assignment. So I also contributed that to, I work well under pressure. So kind of going back and re-narrating some of my experiences has been really important for me to be a thriving clinician because it's not easy. Like And that's something I'm still working on, being on go for 1 hour straight. And then particularly maybe having to do some notes after. I'm not doing the notes. So I have to create a system that works for me and the way my brain operates. So I think for me is creating a system and then being okay when that system's not working, like being able to notice that's not working for you right now. Like you were doing good for a month with that system. It's not working. And also just being kind to myself. There are some days where my tank is 0 and I have to be honest with myself and I have to rationalize. I tell my clinic director, I didn't get those notes done today. I apologize, but I'm really having some executive functioning. Being aware of myself has helped me to be better as a clinician and to thrive just with the business aspect of it all.
I try and make sure that like I set up my environment so then I'm like most likely to be successful. Where like as soon as like COVID hit and we were like all working from home, I was like, I do so much better from home. I am so much less likely to wander around the office and talk to everyone. And I am just like way more productive. I can focus more on my patients. Like I'm better able to do things like working from home. I don't do well in a clinic setting. And I recognize that about myself. And thankfully, Ellie is awesome. And like, they're really flexible about that, where like they allow me to set up the environment for me to thrive. I also know some of the things that I tend to get really like I will struggle with, that it's like, okay, I can't necessarily do this well. I'm like, like talking with a patient because I do need to put on my professional disguise. Like I try and find ways to get those out either before or after, or in some cases during. None of you would know this right now, but I'm actually exercising currently. I have an under the desk elliptical that like you can't tell that I'm doing it. So when I'm feeling really like, ooh, I've got a lot of like, energy, I can't sit still, I can just, I have to make sure that none of my cats are sleeping behind it, because they have been known to go and be like, this is the coziest place and that I want to go and sleep right now, obviously. But like, as long as they're not there, because they do get priority, I can just, put my feet on it. And then I do a little bit of like movement, and it really helps. And kind of recognizing some of those things, or trying to incorporate some of like the things that you struggle with into your day and your routine, and find a way to, work with them as opposed to against them, can really, really be helpful.
I know for me too, like I was fortunate enough where my mom saw through my masking as a kid. So she's a teacher. So she was able to see kind of, oh no, something's off. Like you're overcompensating for something here. So I've had systems and routines in place since 4th grade. And a lot of those systems and routines are still things I do to this day. Writing things down on a physical piece of paper. If it's on a virtual calendar, 9 times out of 10, it's not going to be remembered, even though I get 12 notifications on my phone. And I think just also like in my practice, being honest with like my younger clients of like, you know what, sometimes I'm going to be like a squirrely brain, and it connects with them, and being able to kind of slow down with them of like, what do you see in me that you do? And kind of being able to connect on that level. And it allows that normalcy of not letting it be the whole story, because there's other parts of everything and everyone. So kind of giving that connectiveness of kind of just slowing down and being like who you are and authentic in yourself.
Awesome. These are such good suggestions. Thank you all so much for joining. I feel like we could talk and talk and talk about interventions. And maybe what we need to do next is y'all need to get this book, and we can have like a book club about it, and have like a follow-up podcast where we talk about how much we love or hate this book. So let's consider that, because I think that'd be fun. But thank you so much. I know we all have clients to get to. And so, so good to talk with you all. And yeah, thank you all for listening, and we'll see you next week.